So now we move on to Dr. Deepak Mishra, who will be speaking on Phaco versus SICS, the literature search. Carry on.
Thank you, sir. So, what we are claiming with each and everyone, it's not just a comparison or anything that anything is good or bad. What we find out in the literature, and those literatures which are the good ones, are we can have a high rated literatures. There is no financial disclosure in my talk. So when we see the global incidence of the cataract, this global map clearly show that how prevalent is cataract and how much it is responsible for the loss of vision or the contributes to the blindness. It's not only that is a global part, but its incidence is increasing day by day, or what we can say, if anyone is having two eyes, then at the time of aging he or she almost have, everyone will have cataract in their life. And another thing is that why we are worrying is about it is common in all races and all the continent of the globe. It is not that it is common in one race or one place. So what is the option? The option for the surgical management, which is a complete to get rid of it, is we have to do cataract surgery. And the two major ways by which majority of the cataract surgery has been done are globally accepted is, one is SICS and another is Phaco. I am trying to search the literature on the 3 4 important parameters. One is the time, because nowadays time is important and everyone say that cataract is a 2 minute surgery. Another one is the cost, machine dependency. Just Dr. Salakya answered, so what is the grade of the cataract? And then the most important or another thing is what patient wants is the what are the post operative managements are the things, means how, what will be my vision after the surgery, taking care of astigmatism and another thing. And one thing which is important for the young ophthalmologist is the learning curve, which they have good or better. So on this point I have searched few literatures and I am going to present here their conclusions, not it's my conclusion. One is the time. Yes, we all know that time is always depend upon the experts. And when we started doing indirect ophthalmoscopy, then within few days or of a residency, or sometimes we are even unable to see the globe, but the experts will just put their 20D and said yes, this is RD or that. Same thing is happened to each and everywhere. When we either you are doing SICS or Phaco, then time always depends upon the your skill or the your experiences. But these are the few articles. One is Venkatesh et al. Sir, Dr. Raut and Kulkarni and Dr. Gogote sir, and they have compared that yes, almost SICS and Phaco, whatever the mean time they, like Singh et al. Reported that they did SICS in 5.4 minutes, and the variation is from the Venkatesh, that is 12.5, and here is the same from the Phaco. So almost time taken in expert hands, because all these are the which are the published articles. Even the Kulkarni sir has presented his talk and in the proceedings that he is having this lesser time in SICS. So what we have searched in the literature, I can say proudly that there is no time gap. Even you can do SICS in 2 minutes and Phaco in 2 minutes. It's just depend upon your hand stability and your practice. So in the time, I am not giving any weightage to any of them, either SICS or Phaco, that it is fast or the slow. Second thing is the cost effectiveness. Yes, for the setting of anything, for the Phaco machines and when the consumables you are required, then yes, Phaco required slightly more costing on that. And for that, whatever the charges for the Phaco is more. SICS is always slightly better. Here you can say that initial setup doesn't require so much of machine setup. They only required whatever is your calculator, biometry is required, microscope and other thing. But here is the variation and the studies we have done by different members of that, and two important was done by our own Dr. Parikshit sir. They find out what even is the differences between the caste, and find out yes, these are the various costings of the SICS and somewhere from the Phaco. Here it's looking slightly more. And again, one of the paper which is published in the Lancet, they are showing it is done on the healthcare services in the Nepal, WHO reports. Then they say that in the casting of the SICS is 30 to 67% less. But many of them are asking why there is so difference or large range for the casting in 30 to 67. The basic reason is that it's not that the machine or anything. One thing is the cast of the IOL. Now very much and different expert surgeon are using even the premium IOLs with the SICS. Dr. Raut is using even Toric with SICS. Sir is using, Devashish sir is using. So the cost of IOL is different. Rest of the things are the consumables. That's why the SICS is always have a variable results. Grades, I can say that yes, SICS is good for the all grades of the cataract, and these are the various literatures which showing that which type of cataract is good. And I can say that this is the largest number of data published by Dr. Haripriya and other in JCR. They have that in high volume surgery it is done at Armin with high quality, and they mention that SICS can be done even in all the cases. And other studies also showed like Hindwani et al. That if you want to do in a subluxated cataract or having a low endothelial count or something, then they prefer SICS more as compared to the Phaco. Post-operative vision, when we have collaborated and taken one unadded visual acuity of 6 by 18, then you have seen both in the SICS and Phaco they fall in this same domain. Means statistically there is no difference in any case which is in the which uncomplicated cataract surgery done in either SICS or Phaco. But when we are going for the unadded 6/9, here again you have seen the Phaco is having slightly better positioning in this diamond ring as compared to SICS. SICS is at the edge of this diamond and Phaco is at the middle of the diamond. That means unadded visual acuity is having slightly more in the 6 with Phaco as compared to SICS. But what happens is just because of this astigmatism, because many people are saying that initial whatever we do SICS is having lot of astigmatism and other thing. But when we compare and see that there are various techniques, just Devashish sir shown what are the techniques and how they can manage the astigmatism. So your incision nowadays, your whatever your incision is there, you will find out that in several type only 0.5% astigmatism is that, and in the straight it is 1.25. These are the documented finding. So astigmatism nowadays is not a big consideration for the SICS, because the lot of SICS surgeons and different one they modify their incision types, nature of the incision to reduce this astigmatism. Endothelial cell loss, here I can say that I find only 2 articles, and in this you have seen that endothelial loss is slightly more in the cases of Phaco as compared to SICS. Here is the same grade of the patient of the one is the right eye, another is the left eye. First one is the right eye, and you have seen this is the pre-surgery endothelial cell count, and here you have find out some places that the black spots are these are, this is done by the Phaco, then there is chances of endothelial loss. And another one is the same patient of the left eye done with the SICS. So here you compare, there is no such black spots in this and that. So there is chances that, and we all know that Phaco is having higher chances of endothelial loss. Learning curve, yes, it's again depends upon the both. It's not I can say that it's easy to learn SICS or easy to learn Phaco, and at one of the time when the competencies match, almost both are having the same. So learning curve, it doesn't depends upon the technique, it depends upon the individual surgeon's hands, here his or her interest and number of surgeries they are doing. It's not a one thing that you can do that yes Phaco anyone can do or learn in a shorter time and SICS in a longer time. That is the difference. So coming to my conclusion, whatever the drawbacks and advantages are there, both are almost having the equal things both places. But one thing, yes, on the it, in the part of astigmatism, Phaco is having slightly better management or the outcome as compared to SICS. But whenever you have seen for the grade of cataracts and for this endothelial count, they are at these 2 points SICS is having edge over the Phaco, and even for the subluxated cataracts too. So it's simple and safe that both surgeries are good as compared to literature. It's only the opinion of the experts or their expertise that keeps on the going good or bad. With these thoughts, I would like to thank you, sir. Thank you. Any comments?
Thank you, Dr. Deepak, giving the very good picture of comparing Phaco with SICS. Definitely, as a SICS surgeon, I will prefer that SICS is a more edge over the Phaco. But however, some of our experts are sitting here, they may put that say Phaco is over the SICS. But debating all these parameters what you've shown, SICS is better than the Phaco. So definitely, my youngsters, she is sitting here. Please adopt SICS is one of the best technique in our country under the any circumstances, whether clinical practice, whether the camp practice, wherever SICS has a more edge over the Phaco. So any questions from the one question you can take. Anybody wants to one question you can ask. Then later on
Devashish sir,
we'll move to Dr. Pradeep Mahanta.
Devashish sir, one comment on.
Yeah, please.
Sir.
Dr. Devashish, yeah.
No, actually, to choose like whether we'll do SICS or Phaco in a particular case, I think we have to understand in SICS the incisional trauma is more. So if it is a softer cataract and the grade is less, so you, I mean that incisional trauma may be more. So in those cases, phacoemulsification would be a better access. But if the nucleus is hard, the endothelium is compromised, and say subluxation, some surgeons would be more comfortable doing it with SICS. So these cases, definitely, I think the hardest cataract, where you know you're using a CDE of 40 in phacoemulsification, the next day there will be striate keratitis for sure. But in Rakesh's hand, it won't be there. You have a clear cornea next day.
Thank you, sir. Thank you.
Thank you.
And the
Now
other
it's over
thing
to-
is where
yeah.
there is SIA, I mean say a SIA of 1.5. So like with a straight incision and an opposite OCCI, you can correct up to 1.75 cylinder. So I mean you don't need toric lenses. So cost optimization has a great benefit.
Great.
And if your microscope is not good, I think you better do SICS. And
Thank you,
in
sir.
compromised situations, do SICS.